Hey everyone, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Matt Buch, a doctor of physical therapy, board-certified orthopedic specialist, and the owner of Total Pursuit Physical Therapy and Performance based out of De Pere, Wisconsin. Dr. Matt works with active people of all kinds, from athletes who love to train hard to parents who simply want to run around with their kids without dealing with constant aches and pains. But what really sets him apart is his belief that pain isn't something you just live with. So if you've ever been told to rest more, stretch more, or chalk it up to getting older, he is really passionate about challenging that mindset. His approach focuses on uncovering the root cause so that you can move better and feel stronger for the long haul. Dr. Matt creates customized treatment plans that often combine hands-on techniques like dry needling, cupping, and joint manipulation with strength training, movement coaching, and realistic habit shifts that actually fit your life. It's not just about getting you out of pain, it's about keeping you active long-term. And outside the clinic, he's an avid bow hunter, climber, outdoor enthusiast, husband, and dad to 2 young boys, so he truly understands the value of being able to move well and keep up with the life that you love.
Hey everybody, welcome back to the Motherhood Alliance podcast. We're here with Dr. Matt, and we're excited to have you back here.
Thank you so much for having me back. Happy to be here.
Absolutely. So this is our 4th episode with you, and one thing I have to say is that I really just enjoy listening to how you explain different things. I feel like there could be a lot of fear for some people, especially if they're like, needles, no. But there's so much benefit with dry needling. I know Brittany mentioned that she had dry needling done in the past. I have also. I've had it in my shoulders, and it's definitely it's a different feeling for sure. And it's really fascinating with how your muscles react to the stimulus of the needle. And so first of all, let's just have you explain, what is dry needling and how does that work?
So in a nutshell, dry needling is where we take a very thin, what's called a monofilament needle, which basically means that it's not hollow point, nothing is being injected. That's why we call it dry needling. And we're putting it into a tissue in your body that we are trying to make a change in. So it could be muscle. That's the most common thing that's needled. We also do a lot of needling into tendons for people that have a tendinopathy or like a tendinitis type issue. It can be very beneficial for that. And even in scar tissue as well, for people who have built up a lot of scar tissue. Maybe it's after a surgery, maybe it's from something else, but it can be really beneficial for releasing that as well. So essentially what we're doing is we're taking the needle, and when it goes into these tissues, we'll talk about muscles, for example, because that's the most common thing that we use it for. It's really doing 2 different things. It's changing what's happening inside of the muscle, and it's also changing how the nervous system is acting and changing how your brain is perceiving that pain stimulus. So if we're talking about what's going on at the actual level of the muscle, what is happening is when the needle goes in, we're looking for tight areas of kind of bound up muscle tissue. We call those trigger points. So a lot of times people will refer to it as trigger point dry needling. What that means is that there's an area in the muscle that's just kind of bound up. It's not relaxing the way that it should. And over the course of time, this can start to result in a lot of pain, where people will feel kind of an aching soreness in the muscle because the muscle's not working correctly. It's also cutting off some blood flow to all the little capillaries within the muscle, which results in not a lot of oxygen being able to get into the tissues. So when we hit those areas in the muscle, a lot of times what people will experience is either kind of a deep aching sensation. I like to refer to it as like you're getting a deep tissue massage from inside the muscle. And that's literally what it feels like. Sometimes you'll feel that muscle actually twitch as well. Both of those are really what we're looking for from a sensation perspective. What happens then is that tight bound up area of muscle actually releases itself out, and it allows for improved blood flow into the muscle. So just kind of thinking of it as almost hitting the reset button on a muscle. The other thing that it does is it works the nervous system a little bit as well. So the body has built in pain blockers, and dry needling actually helps turn those on. It's called the gate theory, which we're kind of shutting the gate on pain signals. So the brain then is not necessarily receiving these pain signals from the muscle as quickly. It's helping to kind of slow those signals down so that you're not experiencing as much pain in the muscle after the dry needling is performed.
So when you're talking about like trigger points, I feel like people may have heard that term before. And I think that, a lot of times they might think, using a foam roller or a massage ball or like a hard ball might help with those areas. What's the difference between using those modalities versus dry needling?
Yeah. So the main goal behind a foam roller, a lacrosse ball, the dry needling, the goal is all the same. It's to release those trigger points. What can happen though is especially with like the surface level stuff, the foam roller, the lacrosse ball, even like getting deep tissue massage, is sometimes these trigger points are like way down in the muscle, and it's really, really hard to get to them from the surface of the skin. And in many cases, you just can't. And so people will roll and roll and roll, or they'll sit on their lacrosse ball, and it's like, man, it feels like I'm in the right spot. It feels like it's right there, but it's just not quite releasing. That's when dry needling would be a really good modality, because we can get all the way down into that muscle exactly to where that spot is.
Is this typically a one and done type thing?
It can be. Usually, in my experience, about 3 to 5 sessions is where people land on really getting the full effect of it. So during our first session, a lot of times people will feel an initial relief, but there's still a little bit of it hanging around. They come back for another one. The effect sort of compounds on itself. Every time they come in, they get more and more and more, until we're at the point where it's like, I feel good. I think we got everything. Usually 3 to 5 is somewhere where most people are going to land. If we are 3 sessions in and it's just not feeling any different, it's probably not the right approach, and we'll need to figure something else out. In rare cases, yeah, I have had people that have come in, had it done once, and they're like, I feel good. I think we can move on. I don't think I need this again. So it really just depends on how the body responds to it.
What's the difference between dry needling and like acupuncture?
Great question. So dry needling actually is derived from acupuncture. Acupuncture's been around much longer. The main difference is acupuncture focuses more on, Eastern medicine principles. So I don't want to try and speak too much on this because I'm not an acupuncture provider, but from what I understand, acupuncture is really looking at specific acupoints that are mapped all throughout the body. You're going to target different acupoints for different purposes. And the idea is that it's balancing your energy flow through your body, realigning your meridians, things like that. In dry needling, we take more of a Western approach to it and more of an anatomical approach. So where it really came from is, maybe we didn't fully, think that the energy flow theory was what was causing the relief, but they did see that there was some relief being caused through acupuncture. We're like, okay, well, why is that? And so people who kind of forefronted dry needling started taking acupuncture. Literally, it can be the same tool. Dry needles and acupuncture needles are pretty much the same thing, but using them in a different way. And so in dry needling, rather than going just into the subcutaneous tissue with the needle, we're going all the way down into the muscle, tendon, whatever it is that we're looking for to target that specific spot that's irritated.
As you say that, going all the way down into the muscle or tendon, how would you say this feels? Explain it to somebody who's never had it.
So the actual needle, you almost never feel. It's very small. It's extremely sharp. Usually people will just feel the pressure of like this little plastic hollow tube that the needle kind of goes through to actually get into the skin. That's what people will feel on the surface of the skin. Really, really not a big deal. You don't feel a sharp pain, or at least you shouldn't. What most people will feel is a deep aching sensation. I think I talked about it a little bit earlier. It's going to feel like you're getting a deep tissue massage from inside of the muscle. The nice thing with dry needling, and I always tell this to people to kind of give them a little bit of an at ease moment, is if there was nothing going on in this muscle and it was in, perfect health, you wouldn't feel anything. Nothing would really happen. The more intense the sensation, the more jacked up the tissue is. And so if you're feeling a pretty intense, like, wow, that's a deep ache, like I'm feeling that muscle twitch, it means we're probably doing the right thing to get that thing to release out and calm down long term. What you should not feel is a stabbing type pain, sharp, electric type pain, nothing like that. It's going to feel like an achiness, like an aching sensation.
I really appreciate what you just said, because if you, like you said, if it's a healthy muscle, you're really not going to feel much because there's no problem there. But if it's just like a massage, right? Like if you have tension in your shoulder, it's going to hurt short term while somebody's working on it, but then it feels so much better. So it is short term discomfort potentially, depending on the severity of the area, but then for long term relief. So it's worth it, right? It's worth it. Here's another question is, are there areas of the body that you really can't dry needle? I mean, I'm thinking about how intricate our hands are, or like our feet, or deep muscles like in the glutes where they're like the deepest level. And then for some of these more specialty areas, do you need extra certifications, or like who is able to do dry needling? So kind of a pair of a question there.
Yeah. There are certain areas of the body that I personally wouldn't needle just for safety reasons. So for example, like an intercostal muscle, like the muscles between your ribs. Personally, not worth getting that close to the lungs for my comfort zone. But regarding the hands and feet, we learn how to needle all of those spots, the glutes, everything. You just vary the size of the needle based off of what your target is. And by size, I just mean length, not necessarily like how big the needle is. They're all very thin. So don't.
I feel like they need to find a different word than needle for this.
Yeah,
like
I do too.
Just find a different word.
Okay.
I mean, we all kind of know what it is, but the people that like, I'm kind of a needlephobe. I can't stand it when I have to get my blood drawn. I could pass out on you, but dry needling to me, it can be a different type of experience. So I have had it done. I'm able to handle it a little bit better. I probably don't want to see it. But yeah, I think it's just funny how the conversation continues around like, this is a topic where people feel uncomfortable, and yeah, it might be physically a little bit uncomfortable, but it's going to be worth it. But let's find a different term so people aren't so scared. Right.
I think one thing for people to understand is, if this is something you're a little bit hesitant about, just be upfront with your provider about that. Any time that I needle somebody in the clinic, they're laying down on the table, they're comfortable, they're relaxed. A lot of times, like you said, Britt, like maybe they have their eyes closed, or they're just, imagining themselves on a beach, something like that. It's just really important that you are in a comfortable environment, you're relaxed, and that you're totally okay with the modality. It's a tool. It's not the tool. So it's a great tool. I think it works very, very well. It's not going to be the end all be all, nor is it going to be the right tool for everybody. So I don't want to ever talk somebody into it, but I will definitely let them know if I think it's going to be a beneficial treatment for them.
If you're going to dry needle a certain area, how long does it take?
It can take as little as like 30 seconds if it's just, one needle and we're just kind of going in and out. It can take up to, 15, 20 minutes if we are doing a couple different spots. If we're letting the needles just kind of hang out in the muscle for a little bit, sometimes that's necessary as the muscle relaxes. You just want to let everything just kind of calm down, let the nervous system relax. So usually it's like 5 to 10 minutes. It's pretty quick.
What about, like, is there any sort of recovery to this where after somebody gets needled, should they be like, are there things you recommend to kind of maximize the results? Can it be paired with maybe foam rolling? Is that a no-no? Do you have to like hydrate extra? What are your instructions for afterward?
You always want to hydrate extra. What I normally tell people is the more movement, the better. We want to encourage blood flow into that area. That's just going to help things feel better, and it's also going to help the response. What you normally experience afterwards is about 24 to 48 hours of soreness, and I tell people it feels like you just did a good workout through that muscle. Like if you had needling done up in your shoulder, it's going to feel like you did a bunch of shrugs that day. It's not painful, it's just sore. So heat, movement, any of that kind of stuff is going to be your best friend. What we want to stay away from is ice, anti-inflammatories, anything that's going to reduce inflammation, because we actually want to encourage that little local inflammatory response to improve blood flow into the area, and really flush out any of those old areas that have just kind of been sitting there without a whole lot of blood flow. We want to get some of those like inflammatory cells out of there, and just really pump some new good oxygenated blood through that area. And that's going to help improve the muscle quality. It's going to help improve the overall effect of the treatment, and it's going to just make things feel better while you're in that state of a little bit of soreness afterwards.
Do you have any real life examples that you can share with us of some like injuries or something somebody was dealing with and then they got needling done and it was helpful?
I had one guy come in here with a shoulder issue. He couldn't lift his arm up over his head without excruciating pain. And on his very first session, we did some needling around his shoulder and his neck, and he left that day and he came back for his follow-up appointment, and he was just ecstatic. He was like, I can't believe how well this worked. He was like, look at this. And he's like raising his arm up and down over his head. He was just floored by it. So sometimes it is just a simple, like, let's just get this muscle unwound a little bit because of how irritable it is. And then he actually did the same thing. Like a year later, he came back to see me for his quad and had almost the exact same response. So
is this a common response, or do most people kind of need a couple of sessions typically?
Most people need a couple of sessions. This guy was a little bit of an exception to the rule, but I've seen it multiple times. I've seen it enough where people have had a tremendous response the first time they've had it done. And usually the consensus is like, wow, I wish I would have done this sooner.
Okay, do you have any other examples? Because I like hearing stories, success stories, especially
Yeah,
from people
absolutely.
that are on the fence.
Absolutely. I had a lady about a month ago that was in here. She could turn her head fully to the left, could turn her head about halfway to the right. We did some needling up through the top of her shoulder and up into her neck. And then by the time she left the clinic in her hour session, she was rotating her head fully to the right, which was awesome. And then I had another guy that came in here with low back pain. I had worked with him in the past. He had a little bit of a flare up. Avid mountain biker. He was about ready to go up to the UP for a race called the Margie Gessick. It's a high-level endurance mountain bike race. His back had tightened up on him because he had a little incident in the weight room the week before. And we spent some time, did a lot of needling through his back. He texted me the next day saying he felt fantastic. And he beat his time in his race by like, I don't even remember what it was, but it was by like 10 plus minutes from the last time he ran it. So that was pretty awesome too.
Yeah. So don't be scared. Don't be scared. Okay, so if somebody is maybe struggling with a long-term pain point or is just curious to learn more, obviously we've talked about your free consult, especially at the end of episode 1, you kind of really went into the length of that and what that looks like. So they can obviously do that. But do you have any other like last thoughts or things that you'd want people to know about dry needling as we close out this episode?
The number one thing I want to tell people is it can be intimidating. It is a very, very safe modality. And if there is a reason that you can't have it done, there are a couple, red flag issues, like bleeding disorders or something like that. We're going to screen all that stuff out before we start, because we want to make sure that this is 100% going to be a safe option for you. The other thing is that it's a great tool. It can help people a lot, and it is just that. It's a tool. Usually it's not going to be just a one and done thing or a treatment protocol in and of itself. So anytime we're looking at dry needling somebody, we always want to follow up those positive changes that we made by improving the strength through that new range of motion or building up somebody's tolerance to whatever activity they're doing, so that they don't find themselves in a place where they feel really good, all of a sudden, shoot, couple weeks, couple months later, now I feel like I need to do it again. We want to help you improve from whatever it is that you're struggling with permanently. Dry needling is a great way to accelerate that, but then we always want to follow that up with a proper rehab protocol as well. So yeah, it can be intimidating, especially for people who don't like needles, but it's such a good tool, and it can provide such positive and quick results for people. If you're on the fence at all about it, I'd certainly encourage, trying it, because it's probably not as bad as you think it's going to be.
I'm guessing people don't typically come into a PT office just for a la carte dry needling session, and then there's like nothing else to follow up with it, right? Like, because you're trying to find the root cause of what's causing somebody's issue, and this can like release the tension, but then, okay, what caused this tension in the first place? I also think about a quick fix people are oftentimes doing is a cortisone shot. Well, that's masking the problem for now and maybe gets you a few months of relief, but then it's going to come back because you didn't fix the problem. So I do appreciate how you're laying it out as kind of a tool in the toolbox of a PT and how it can be really beneficial. So to finish out all 4 of our episodes together, we always love to ask a final question, which for you is going to be, what is the future of Total Pursuit PT?
Absolutely. That's an awesome question. My vision for the future of Total Pursuit is we're going to reframe how our local community sees physical therapy. Because I think, unfortunately, a lot of times what ends up happening in our modern medical system is people are seen for quick visits. Most of our modern medical system, insurance companies, all of that stuff, they incentivize quick fixes, pain management, and getting people in and out the door. Our goal is to build a relationship with our clients, understand what their goals and what their aspirations are, and then figure out a plan that's going to get them to there, and then most importantly, prevent this issue from coming back again in the future. And I do think that is where the future of physical therapy is headed. It's not there yet, but our goal is to push that and really be on the forefront of making this a lifestyle change, helping people, figure out why they're in pain, and not only just, slap a Band-Aid on it and address it, but actually dive all the way into fixing the real reason that they found themselves in this position in the first place, so that they don't need us again. And that they can continue to do their thing and live their life and just, spend time with their kids and their grandkids as they get older, and all of that stuff that's going to really give them meaning later on in life. So we want to be known as the clinic that was on the front lines of that, and the clinic that, really raised the bar in terms of patient success and just culture, and really building something that people are going to find, high level results with.
Can't wait to see it all unfold. I mean, I think there's so many wellness businesses in our area that are so passionate about that same thing of just helping people understand that there are choices out there, and we don't have to settle for short appointment times and huge bills and all this other stuff. And that's also why you are a cash-based clinic, right? Yeah, because then you're not held back by the limitations of insurance, and it gives you the flexibility to truly actually help people with a plan that you can customize. So that's great. All right. Well, thank you, Dr. Matt, for joining us for all 4 of these episodes and educating all of our listeners and us as well. We loved having you on.
Absolutely. Thank you so much for having me. This has been fantastic.
You bet.
If you enjoyed this episode, would you consider leaving a rating or review, or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.